So I let patients go home on the same day of the operation. And I always say to my patients, you will walk from the hospital bed to the car after the operation. They are allowed to weight bear on the foot, and they use a special surgical shoe, which has got a stiff sole, which we give them. Patients might use crutches. It's optional. If you have a sore foot and you've got strong arms, you might use crutches. But if you haven't got strong arms, you can walk on it. So patients are allowed to weight bear. They're allowed to do stairs immediately. What we find is, to get the best result, the first 2 weeks, I encourage my patients to try and elevate the leg as much as they can at home. And I would like the patients to elevate their leg for at least 50 minutes every hour. So that means that for most of the day, they'll be sitting not in bed, but they might be at their desk with their leg up, they may be on the sofa with their leg up, they may be in the kitchen with their leg up, but they're resting with the leg elevated. That's what I like to do for the first 2 weeks, because that's when we want to make sure the wounds are healing and that the swelling and the pain is under control. If they do well at 2 weeks, then I push them much faster. And in my practice, I will take them out of the plastic shoe or the hard shoe within about 3 to 4 weeks and have them walking in trainers. One of the problems with any operation in the foot is it does swell, and the foot will be swollen. So it's not a problem because we know it's going to be swollen. So though it's a discussion point that we always worry about, certainly it's not a permanent swelling, but it will be swollen for a few months. So the shoe options are a bit more limited, but I will get them up, and you get good results if you get them walking quickly, because you get less swelling, you get less stiffness, you have less pain, and you have quicker restoration to function. So people ask, well, when can I walk my dog? And I'd be quite happy for them to be walking their dog at 4.5, 5 weeks. In terms of exercise and sport, running, for example, quite happy for them to start running around 9 to 10 weeks if they feel up to it. It's not a problem if they're loading the foot properly. And in terms of wearing more elegant shoes, I usually say about 3 to 4 months. Absolutely. I mean, I often will do, we call it bilateral bunions at the same time, where we do both feet. And the reason is that, it's not twice as hard to recover from the operation, but it is about 1.5 times harder. But the key thing there is, as a clinician, I need to assess the patient. I need to see that they have got a suitable environment at home. They've got a supportive network of family, for example, around them to help them in that initial phase, just to make it easier for them. But if it's there, of course we can do it. Yes, they can come back, but if the surgery is done well, then the recurrence rates are extremely low, and they're unlikely to come back to any degree of the severity that they were there before. Modern bunion surgery involves breaking the bones and resetting the foot, and if you do that, the recurrence rates are much lower.